All this week, here and there on the programme and across the BBC, in fact, we are having conversations about something that affects so many people, and that is dementia. The BBC's launched Memories and Dementia with special collections available on BBC iPlayer, BBC Sounds. There's a website you can go to and find all of it, which is bbc.co.uk/memories and dementia. The idea is to make use of the BBC's huge archive to help people trying to live successfully and happily with dementia and connect to memories and moments that can be really, really powerful. It's more than just a trip down memory lane. It's all about support and supporting people living with dementia and their families and their carers, the people that love them. With me to talk now, Helen Lofts, who is the owner of the care company Visiting Angels, Burton and Derby. Good afternoon.
Ian. Hi.
And
thanks
Ashleigh,
for inviting us.
thank you for coming. Ashleigh's here as well. Ashleigh Smith, who's the manager of the company. Hello.
Hello, how are you?
Really good. Lovely to see both of you. Visiting Angels. I feel like there's a fairly predictable answer, but what is it that you do, Helen?
So we are a care company, predominantly in Burton and Derby now, and we support elderly clients and people with dementia to enable them to live in their own homes, to live as independently as possible. And we find now that probably about 50% of our clients have got dementia in one form or another.
How can visiting carers make a difference?
It's about building relationships. What we find is that one of the first barriers is the fact that an individual has probably been supporting their loved one for a long time and sometimes can reach crisis point before reaching out and asking for support. And then it's about building that trusting relationship, both with that individual and the person that they're caring for. And that can only be built on time. And it's about putting in consistent and continuous care. So, in other words, that person sees the same face week in, week out, because you are never going to build relationships unless you do that. And with someone with dementia, that's absolutely critical, that you've got to have that continuous and consistent care. And my job, therefore, is to recruit and then retain the best carers. And I'm very proud to say that in an industry where the care turnover is probably around 70%, we had an award-winning retention rate of over 99% last year. So we are well placed to build those relationships.
Ashleigh, what can, I mean, people who are looking after, who have people in the family maybe who are dealing with memory issues or they know have a diagnosis of dementia, from the expertise that you professionally have, what advice can you give people just to look after people that they know?
Patience, empathy. You always have to look at a person as a person, which is often forgotten about. When we're looking at dementia, I think people get kind of fixated on, what type of dementia have they got, or were they aggressive yet? And we look at that in more of a negative way than a positive way. So, the amount of vast, different types of dementia, it shouldn't matter because that person is a person still. We have to kind of just break down those barriers to getting to know them as an individual and not seeing them for a medical condition. So I think for me, it would be, in terms of my training to staff, it is be empathetic, be sympathetic, be patient, because relationships do take time to build and literally seconds to crush. So if, you're caring for somebody with dementia, there's going to be some little top tips which I'll share today on how to deal with maybe some challenging behaviour, some behaviours which you may not necessarily know in that moment, how do I kind of conquer this situation? How do I come out of this situation with the best positive outcome? And that's what we do in, day out, is supporting caregivers to be that little angel that person needs to, open that door to them.
How do you know? Because so often we know it's a progressive condition.
Yeah.
How do you know when it's time to ask for someone else to help her?
I don't think you do know, really. I was speaking to a lady that I know quite well last week, and she has been caring for her husband. And she said, Helen, my life has become so small and I feel like my head's going to burst. And I said to her, it really is time that you reach out and ask for some support now. And there is, it's not just all about going to a care agency either. There is so many avenues of support out there. We sponsor a carers cafe in Burton-on-Trent, where carers and those that they're caring for can go twice a week and in a group setting just have other people to chat to,
And with just what you do, as how does it work? Funding, the important stuff of, can people come to you and pay directly if they're lucky enough to be able to afford to? Can they apply to the local authority and they'll send you round? Do you have any say in who visits?
The funding privately funded clients come directly to us. If they feel that they're eligible for any help, then we can point them in the right direction, and they would have to then go down the social services route and have a financial assessment. But that doesn't preclude us from still going in, because people can have direct payments and then choose their carers rather than social services saying this is who you're having. And we have quite a few clients that choose to do that, so that they can have...
You must meet some really stressed people.
Yes.
There's so much to deal with, right?
Yeah. And I say...
And I don't mean just the dementia.
No, some people have absolutely reached crisis point and they don't know where to turn. They get very conflicting advice from lots and lots of different areas. And we are there to try and smooth that journey. And, you don't have to be a client of Visiting Angels to pick up the phone and just ask for a little bit of advice.
Or go on the website. I mean, you mentioned top tips, Ashleigh. There's a whole list of stuff I was reading on the Visiting Angels website about creating routines and familiarity.
Yeah, I think it's that signposting which is often probably missed. You put in dementia in Google and you'll get thousands of web pages on various different things, but there's nothing to actually say to somebody, this is how you do it. There's no guidebook on it because every person's different. When I do my training, I refer to individuals as individuals because that is exactly who they are. But on a piece of paper, which half the time, when you're looking at the bigger picture of care, is you get certain things just noted down, their gender, their age, their medical conditions, and that's not very person-centred. So the way that we person-centre everything is by going out to do their assessment, introducing who we are to them, what we do, because if you are trying to get your foot in the door with somebody with dementia, going in talking about 4 calls a day, we can help you with showering, we can help you with washing, they might not necessarily associate that they even need help at that point. And that's one of the first barriers which we have to overcome. So, if that is the situation that we're in, we often start off as companionship, really, to build up that rapport, to get them comfort levels, to get them, introduced to one another, to feel comfortable with one another, which then hopefully further down the line will open up another door to then a little bit more support, a little bit more care.
Your staff, I mean, I'm just thinking, and this will reflect on carers and relatives and loved ones as well. They sometimes find it really frustrating rather than just rewarding.
Oh, yeah, absolutely. There's going to be days where you find a little bit more challenging behaviour than others, but we all have rough days, don't we? We're only human. So I think when we're looking at dementia, that negative association has to be pushed to one side. You have to see that person for who they are at that point, at that moment in time of thinking, oh, okay, what are they going to accept off me today? How could I potentially frame this in a way where this is their choice? So when we're looking at choices especially, and dementia, a lot of people will go, well, they don't have capacity. There's more to life in thinking that someone with a diagnosis of dementia has absolutely no control over making their decisions, and that is absolutely wrong, because they can make a decision on what they want to wear. We can tell them the weather, or it's maybe a little bit too cold for that strappy dress today, Mavis, and it's just those little bits of input to allow them to feel in control of that situation.
And still have agency.
Have that agency, have that autonomy, and not a carer going in saying, we're doing this, or we're gonna do that this morning.
Doing this to you or for you.
Yeah, absolutely. And I think it's just important to just remember that they are still a person. Yes, they have dementia, but they are still an individual.
It's all about familiarity, relationships, and positive outcomes.
Yeah.
And making sure that everything we do has a positive outcome. And our visiting angels are just that. They
Absolutely.
are angels to these people.
It's lovely to see you both.
Yeah.
Thank you for coming in
You're
today.
very welcome. Thank
Helen
you for
Lofts,
having us.
Ashleigh Smith
Thank
from
you for
Visiting
having us.
Angels, Burton and Derby. I should just remind you of the website where there's loads and loads of resources. It's been launched this week to go with the conversations that